Okay, we are live. If you want to wait maybe 3 more minutes for people to join, then it's okay. Or you want to start, you can start. If you want to.
Okay, we'll just wait for 1 more minute and then we'll start. Yeah. Yeah, okay, I think we'll start. Good evening and welcome to one and all. We usually have a habit of, drinking tea or coffee in the mornings and evenings. And it's not only delicious, but also linked to numerous health benefits, including reduced inflammation, or it has antioxidants. So today we are going to see how tea affects our eye health. And to give this talk, we have young and dynamic Miss Aditi Mishra, who conducted research on this topic. So she completed her bachelor's from Lotus College of Optometry, Mumbai. She comes from a family background of opticians and has around 8 optical stores in her extended family. Her father is India's zonal head in a lens company, and she aspires to get into the corporate world someday. She's currently handling 2 stores, and she has upgraded them to accommodate optometry practice. She is currently pursuing a PG diploma marketing and business management in order to understand the business world. So welcome, Aditi. Over to you now.
Hello. Thank you for your warm welcome. I did this research during the last year of my internship at Lotus College of Optometry. We all had heard a lot about coffee and caffeine and how it affects our health, how it affects our eyes, and we had to do something. Our research was supposed to be something keeping in mind that we have to do something that throws some light upon how things affect our eyes and what difference does a different thing make on our eyes. So I was trying to get a topic which is more relevant on our Indian population and our day-to-day activities. And that is when it clicked me that being an Indian, I think I drink tea at least 4 times a day without even thinking about it. So, what could it affect? How could it affect our eyes? And after doing a little research, I found out that it does in fact affect our eyes on various level, not just our eyes, many other functions of our body as well. So then on, I did some more research to connect a little more about tea and ice, and then I came forward to the topic on which I did my research. So some basics I would like to share with you all first is as we know that coffee has caffeine, tea has tannins and tannic acid, which are nothing but polyphenols, which are present in lots of fruits and vegetables, tea leaves being one of them. The thing is how they affect our body in general. So, just a little introduction here. Tannins, commonly referred as tannic acid in tea, just like caffeine in coffee, are water soluble polyphenols present in many plants and foods. And green tea contains many types of polyphenols, tannin being one of them. They have been reported to be responsible in various physical conditions like decrease in feed intake and growth rate, feed efficiency, and many other things, including our metabolism. So the thing is, I had heard as a child that we should not have tea before meal time. This is when I understood that it uh, acts as an inhibitor. So if you have tea before your meal time, you will not have that urge to eat anymore. Polyphenolic compounds show various biological activities that can be used as antimicrobial and antiviral drugs as well. So, yes, it's not just the downsides about it, but they also have some antibacterial properties also. That is why we Indians anciently started drinking tea. But the thing is, the difference between then and now is early on it was just water and tea leaves, black tea or green tea as we call it today. We now add milk to our tea, and as the last statement shows, milk reduces the antibiotic level, the antibacterial properties of the said tea. That is why I did some more research, found out some literature that connected how tea leaves and the polyphenols and the tannins in tea affect various other health parameters, and the relation between milk and tea. Some of these researchers also mentioned the concentration of fats in tea. So we all know about milk, how it is full fat milk, fat free milk, skimmed, semi skimmed milk. The concentration of that as well depends on whether the antibacterial properties are going to be, more inhibited or less inhibited in your tea. There was one of these researchers which was done on a hot peppermint beverage, wherein the intake of this said hot peppermint beverage was affecting some tear parameters, which led me to believe that a lot of Indians have hot tea. So, how would that affect our eyes? That was my aim for this said study. Methodology was a little tricky because we had to have in order to find out how exactly it affects our eyes, we had to have it completely controlled. It had to be uh, very controlled. We could not leave many variables because the more the variable in a research, the more your uh, final results might be not very correct or not very on point. We wanted to make a very tight research for a graduate level. We had two groups, basically a control and a case group. There were various baseline tests that we had decided, a detailed history being one of them, because if my patient had any pre-existing ocular history for tear film or any tear film disorder disease, it would make a very weird result. It would not come under my inclusion criteria. Other things that we took into consideration was slit lamp evaluation, tear prism height, non-invasive tear breakup time, meibography, and interferometry, along with, of course, the OSDI score. So the two groups were the inclusion and the exclusion criteria. Anyone with any irregular astigmatism, any history of dry eyes, contact lenses, any medication, history of contraceptive, beta blockers, acne medication, anyone with any connective tissue disorders, anything that could affect the tear film, the tear layers, or the tear in its own would be excluded. So inclusion would be everything except for that, and people in the age group of 18 to 39 years. As I mentioned, it was a case control study. All participants had priorly signed their own consent forms. All the procedures were done as per the ethical committee's approval. The participants were also given a list of things to avoid, or the second option would be for them to come empty stomach, because the washout period of tannin and tea is 8 hours approximately. The same examiner, I myself conducted all the tests so as to keep again the same thing, no variables, lesser the variables, better for any research. The study was conducted, of course, at Lotus College of Optometry. And after all the baseline information, uh, respectively, the case and the control group were given same amount and same temperature of hot tea and hot water. And then all the post and pre readings were recorded after 1 hour, after 3 hours to see what the results would be like. We had calculated our sample size to be 88, so 44 in each group. As I mentioned earlier, we were trying to make this a very controlled study. So my motto was to have almost, if not the same number of male and female. So here we had 41 male and 47 female participants in the study. The study itself was very easy, but the thing about it was to get those patients at the same exact interval. As I mentioned, the study was before 1 hour, after 1 hour of consumption, and then 3 hours of consumption. So my patient would have to be with me for 4 to 5 hours, which was a task in itself to keep someone standing with you, sitting with you for 4 hours, 5 hours. Um, So my result for the control group, which consumed hot water, was pretty average. I was actually intrigued to see the meibography had absolutely no change in either of the groups. The tear breakup time, the tear prism and the interferometry, as you can see, had some minor changes after the consumption of the hot water, but not anything significant, nothing to take a note of. It could have been a normal hourly change. Here is something which I personally felt pretty shocking and pretty good, because here, as you can see, I'll just take this one by one. In interferometry, where we check the tear quality, you can see post consumption after 1 hour of consuming hot tea, the values drastically reduce, and after 3 hours they come back. So when I mentioned that the washout period of tea is 8 hours, in 8 hours tea completely leaves our system, but as the result shows that by fourth or probably fifth hour the effects start varying significantly, because the tear quality, as you can see in tear breakup time as well, tear prism as well, the tear quality is significantly reduced after the consumption of tea, and then it comes back to somewhat normal, if not better, after 4 or 5 hours. Meibography should not have shown any changes as it did. Before and after consumption, there were no changes in meibography. Because even though physiologically the quality of tear or tear film might change, physical glands would not change. So Nebo was exactly same before and after. So that was my research. That was what my research was all about. Post consumption of water, no changes were noticed in the tear parameters, as I just showed you in the results. But the T factor was quite an eye opener for me myself. Now, here comes the entire discussion of my topic. What, uh, how would we use this research in our day to day life? As it clearly mentioned in my other literatures, adding milk is what actually brings about the catechin recovery down. So, what is catechin recovery? Catechin is basically polyphenols and the antibacterial properties it has, antioxidants it has in the tea. So, when we add milk in our tea, because of the addition of milk, irrespective of if it is fat free, semi skimmed, skimmed, or full fat milk, adding any sort of milk in it will reduce the polyphenols, will reduce the entire antibacterial property of your tea. It will reduce any antioxidants that were in your tea that would be beneficial for you. And catechin recovery is again the reformation of those antioxidants, which also reduces. So if you are to drink tea, it is recommended as per the result of this research that you do it without the milk. Do not reheat your milk. That also causes further decline in the antioxidants in your tea. I know it is difficult for Indians to quit milk tea, but that is what is important for you right now. Also, in some of these other researches, where apart from milk, just the hot beverage also affects your tear film. That is something that was incredibly intriguing to me. In the second research here, you can see the tear film quality decreased after the consumption of a peppermint drink. That also brings me to wonder if not just tea, but any hot drink would cause a decline in your tear films. We know for the fact that caffeine in coffee makes the tear production a little increased immediately after consumption of coffee. So we know that coffee also affects the tear film, but to what extent? That is the question, yeah. Any questions?
Yeah, thank you, Aditi. Thank you so much for the talk. From your research, do you think, long-term consumption of the tea can cause the dry eye disease? Long-term consumption or those who are the frequent drinkers?
It is a possibility, although I would not say it would cause dry eyes or dry eye disease, as we know. It will, however, cause the feeling of dryness immediately after consumption of tea, probably. Because we also see that it recovers in 3 to 4 hours. So it is not a permanent change. It does also recover again.
Okay. And according to your research, what component of the tea would be causing the changes in the tear film? Have you come across this in any literature review or anything?
My research was ideally supposed to be about tannins, but it was not very easy to find out exactly all these components. It goes a lot into microbiology. So we made it about tea and milk. Milk definitely makes these changes in the components inside your tea. So it is, as I said earlier, it is recommended to have tea how it was meant to have, with steeped or brewed in water with whatever spices you would like without milk.
Oh, okay. Okay. And was there any assessment done to see the effect on the posterior section?
No.
Okay. All right. Any questions from the audience? Mm. Okay. Aditi, have you come across any comparison between tea and coffee as such in the research?
Not between tea and coffee. Actually, as I said, I was trying to do something with coffee itself, but a lot was already done with coffee, and I was just wondering why anything is not published about the effect of tea on the eye. There are some things published, but majorly about the posterior segment. Nothing about consumption of tea in your tear film as such I could find. So that is why I chose to do this. But no, I haven't yet come across anything comparing coffee with tea.
Okay. Yeah. Okay. Any questions? Okay, I think there are no questions from the audience side. Thank you, Aditi, for giving us your valuable time and be here with us for the talk. It was a very engrossing talk, and I'm sure many tea-loving, curious minds would have got their answers. Thank you for supporting OCI, and we wish you all the best for your future endeavors. I just would like
Thank you
to
very much.
yeah, I just like to announce that OCI has started a life membership also for students. So students from first year, they can enroll for the lifetime membership through OCI, and we'll be having separate benefits for the students and practitioners. So please check out our website if you get time for the benefits of the membership. And I would like to encourage all the professors and faculties in the colleges to motivate their students to apply for the lifetime membership of the OCI. Thank you so much, all. Yeah.